living your healthiest, most vibrant life, especially as you embrace the wisdom and experience of your golden years. What if I told you there's a particular kind of whisper from your body, a signal so critical that if you're over 65, ignoring it could have catastrophic consequences, potentially even life-threatening ones? We often brush off aches and pains as just part of getting older or attribute new sensations to everyday stresses or minor ailments. But today, we're talking about one specific type of discomfort that medical professionals, without exception, urge you to never overlook: any new, persistent, or worsening chest pain or discomfort. Now, before we dive deep into this incredibly crucial topic, please remember this vital disclaimer: I am not a medical doctor or a healthcare professional. This information is purely for educational and informational purposes, designed to raise awareness and encourage proactive health management. You must always consult with your primary healthcare provider or call emergency services immediately if you experience any concerning symptoms. Your unique health profile and existing conditions mean that personalized medical advice from a qualified professional is absolutely essential. With that incredibly important note out of the way, let's explore why this particular pain, chest pain, or discomfort is so critically important for anyone over the age of 65, and why waiting even a few minutes can make a life or death difference. As we gracefully age, our bodies undergo changes, and unfortunately the risk of serious conditions like heart disease, stroke, and other cardiovascular events significantly increases. What makes chest pain particularly insidious in older adults is that it often doesn't present in the dramatic Hollywood heart attack way that we see in movies. Instead, it can be subtle, atypical, and easily mistaken for something far less serious, leading to dangerous delays in seeking critical medical attention. For many over 65, chest pain might not manifest as the classic crushing pain in the center of the chest radiating down the left arm. It could instead be described as a mild pressure, a feeling of indigestion, discomfort in the jaw, neck, back, or stomach, shortness of breath, unusual fatigue, lightheadedness, or even nausea. According to the American Heart Association, AHA, older adults, especially women, are more likely to experience these atypical symptoms, making early recognition even more challenging. Dr. Nieca Goldberg, a cardiologist and medical director of the Joan H. Tisch Center for Women's Health at NYU Langone Medical Center, often emphasizes that women in particular may have subtler symptoms that can be missed, leading to delays in diagnosis and treatment. This phenomenon isn't limited to women. Many older men also experience non-classic symptoms. The danger lies in self-diagnosing these subtle signs as heartburn, muscle strain from recent activity, or just general fatigue, when in reality, they could be the body's urgent cry for help, indicating a life-threatening emergency. So, what exactly could new, persistent, or worsening chest pain or discomfort signify for someone over 65? The most immediate and life-threatening concern is a heart attack or myocardial infarction. A heart attack occurs when the blood flow that brings oxygen to the heart muscle is severely reduced or cut off completely, usually because a coronary artery becomes blocked by a blood clot. If blood flow isn't restored quickly, the heart muscle begins to die. For older adults, particularly those with diabetes or other chronic conditions that can affect nerve function, a heart attack might even be silent, meaning it occurs with very few or no recognizable symptoms. This makes regular checkups and heightened awareness of any unusual changes even more vital. Beyond a full-blown heart attack, chest discomfort could also be a sign of unstable angina, which is a condition where your heart doesn't get enough blood flow and oxygen, but the heart muscle isn't dying yet. However, unstable angina is a medical emergency that can quickly progress to a heart attack or cause severe heart damage. Unlike stable angina, which typically occurs predictably with exertion and resolves with rest or medication, unstable angina is new, worsens, occurs at rest, or is more severe and frequent than previous angina. But it's not just cardiac events that present as chest pain. There are other equally, if not more, urgent conditions that require immediate emergency intervention. One such critical condition is an aortic dissection, This is a rare but often fatal condition where the inner layer of the aorta, the body's largest artery, tears, causing blood to surge through the tear, splitting the inner and middle layers of the aorta. The pain is typically described as sudden, severe, ripping, or tearing, and often radiates to the back. Aortic dissection is a true medical emergency, and rapid diagnosis and treatment are essential for survival. Another life-threatening cause of chest pain, especially in older adults who may have reduced mobility, recent surgery, or certain blood clotting disorders, is a pulmonary embolism (PE). This occurs when a blood clot, typically originating in the leg, deep vein thrombosis or DVT, travels to the lungs and blocks an artery. Symptoms can include sudden sharp chest pain, often worse with deep breaths or coughing, shortness of breath, rapid heart rate, and sometimes coughing up blood. A PE can severely strain the heart and lungs and, if large enough, can be fatal. Of course, not every instance of chest pain in someone over 65 is an immediate life-threatening emergency. Other conditions like severe gastroesophageal reflux disease, GERD, or heartburn, muscle strain in the chest wall, pleurisy, inflammation of the lining of the lungs, or even anxiety attacks can mimic cardiac symptoms. However, the crucial point that doctors emphasize is this: you cannot self-diagnose these symptoms. Because the potential causes range from relatively benign to immediately fatal, and because the symptoms can be so similar, the only safe and responsible course of action is to seek immediate medical evaluation. As Dr. Erin D, Michos, Associate Director of Women's Cardiovascular Health at Johns Hopkins, often stresses, never delay seeking care, even if you think your symptoms are minor. It's always better to be safe than sorry. Healthcare providers would much rather you come in for what turns out to be heartburn than for you to stay home and suffer irreversible damage or worse from a missed heart attack or another critical condition. So what should you do if you, or someone you know over 65, experiences new, persistent, or worsening chest pain or discomfort, or any of the atypical symptoms described? The answer is unequivocal. Call 911 immediately. Do not wait to see if it gets better. Do not try to sleep it off. Do not drive yourself to the hospital, and do not ask a friend or family member to drive you unless absolutely no other option is available. The reason for calling 911 is critical. Paramedics can begin administering life-saving care the moment they arrive, often performing an electrocardiogram (ECG) right there and transmitting it to the hospital, allowing doctors to prepare for your arrival. Every minute counts when it comes to a heart attack or other critical emergencies. Prompt medical attention can significantly reduce heart muscle damage, prevent irreversible complications, and dramatically improve outcomes. While waiting for emergency services, try to remain calm, loosen any tight clothing, and if you have been prescribed nitroglycerin for a heart condition, take it as directed. Be prepared to describe your symptoms as clearly as possible. When did the pain start? What does it feel like? Pressure, sharp, dull, squeezing, burning? Where is it located? Does it spread anywhere else? Arms, back, neck, jaw, stomach? What makes it better or worse? What other symptoms are you experiencing? Shortness of breath, sweating, nausea, dizziness? Also, provide a brief medical history, including any medications you're taking. This isn't about creating fear. It's about empowering you with crucial knowledge. It's about advocating for your own health and understanding the unique ways your body might signal distress as you age. Your ability to recognize these vital signs and act swiftly is your best defense against potentially devastating health crises. Remember, our healthcare system is there to help, and seeking emergency care for chest pain is always the correct decision. Your life and your long-term health are too precious to gamble on self-diagnosis or delay. Taking care of yourself in your golden years means being acutely aware of your body's signals and knowing when to seek immediate professional help. What are your thoughts on this critical topic? Have you or a loved one experienced similar situations, and what was your outcome? Please share your experiences or any questions you might have in the comment section below. Your insights are incredibly valuable to our community, fostering a space of shared learning and support. And if you found this video informative and helpful, please give it a big thumbs up, share it with someone who could benefit from this vital message, and don't forget to subscribe to the channel and hit that notification bell so you never miss out on our future content designed to help you live your best life at every age. Thank you so much for watching, and here's to your continued health and well-being.